Thank you, Peter, for your kind presentation. So, if you look at the pressure produced by compression, and you see at the pressure produced by an elastic material, you see, for instance, an elastic material applied with 40 millimeter mercury, and the patient just does some foot dorsiflexion while in supine position. You see very huge amplitudes, and when the patient stands up, you see that the pressure goes from 40 to 80, and when the patient does some movement of the foot here, you see again very large amplitudes. If you look at what happens with an elastic stocking, you see a completely different pressure profile. You see first the elastic stocking exerts a pressure of about 20 millimeter, a little bit more than 20 millimeter mercury, and the amplitude are very small, and when the patient stands up, the pressure increases by a very small amount. So our simple question, stocking or bandages, all the same? The response is no, they are not the same. And this depends obviously on the elastic properties of the material. The stiff material doesn't give way to the muscle increase during contraction, doesn't tend to reassume its initial length when stretched, and so exerts a very high standing and working pressure starting from a relatively low resting pressure. So this material exerts quite an intermittent pressure that is effective because it's strong in a standing position and low in supine position, and so comfortable. The elastic material is completely different. It gives way to the muscle increase during its contraction, tends to reassume its initial length when stretched, so it has quite a squeezing effect that is painful when it is maximally stretched, and exerts a standing and working pressure slightly higher than the resting pressure, so we have a sustained pressure that can be uncomfortable when it is strong. And compression pressure is very important because it's the deciding force to narrow or occlude the venous lumen, and this is necessary to exert an hemodynamic effect. And if you look at the pressure that we have in the leg, the venous pressure, it depends on physics law because it is due to the hydrostatic pressure. And so at the ankle level you have about 90 millimeter of mercury, and it goes up and up, the pressure decreases. And this was also documented by interesting experiments with duplex. With a window here you can insonate the veins, and you can see that you need a very low pressure to occlude the vein in supine position, a higher pressure in the sitting position, and a very high, strong pressure in the standing position. And this was confirmed by study with magnetic resonance. You see here a huge varicose vein. It is compressed in supine position with a liner of 18 millimeter of mercury, and is completely occluded when you add a second stocking exerting 35 millimeter of mercury in the supine position. In the standing position, you see here, you don't have enough pressure with an elastic stocking. You see that this stocking exerting a pressure of 34 millimeter of mercury in supine position and 40 in standing position is not enough to occlude the superficial veins, and only a very strong inelastic bandage exerting a pressure in standing position of 80 millimeter of mercury is able to occlude every veins in the leg. So once again, if you have this kind of material and 70 millimeter of mercury is about the pressure necessary to occlude the veins, you see that this pressure overcomes the occlusion pressure, so to say, and so you're able to restore a kind of valve mechanism because at every step you occlude your vein. This is not true for elastic material and for elastic stocking mainly, because you see that the pressure is never able to reach the occlusion pressure, and so this kind of material doesn't exert an hemodynamic effect. So, bandages or stocking, it depends on the indication to compression. When you need to influence the vein lumen and exert an hemodynamic effect, it is necessary to go for an elastic bandage. When we don't need this hemodynamic effect, elastic stocking or elastic material are enough. And if you see at this summary of randomized control study for compression, you see that focusing on the C0 to C5, this is, I would say, the kingdom of elastic stocking. You see no indication for bandages in this clinical situation. And you see here some strange things. We don't have any randomized control study for varicose veins, you see here, and we don't have any varicose, and we don't have any randomized control study for edema. And maybe this is failed because everybody uses compression in C3. So maybe this is due to the fact that nobody wants to lose time to refer something that is completely obvious. And you know that in edema, we are used to distinguish between a therapy phase when we use an elastic bandage to reduce edema and the maintenance phase and we use in this case, elastic stocking to maintain the results and prevent recurrences. But we were able to show that elastic stocking are effective in reducing swelling significantly, and compared with bandages, bandages are faster in reducing edema, but only slightly and not significantly more effective after 7 days. And so you can use in chronic edema also elastic stocking to reduce edema, provided that you can change stockings as the leg volume decreases. Coming to C5 and post-procedure, this could be the kingdom, I would say, for the bandages. But if you look at the randomized control study, you see that there is some space also for elastic stocking, providing a strong pressure higher than 30 millimeter of mercury. But you must be very careful at these randomized control studies, because very often we are comparing, so to say, apples and pears, because comparing elastic stocking and elastic bandages, you know exactly what is the pressure exerted by stocking, but you don't know usually nothing about bandages, so you don't know who applied the bandage, the level of expertise, what kind of bandages were used, what kind of pressure was exerted, adherence to treatment, if the bandage was effectively applied, if they exerted tourniquet, leakage, or rolling. And so it can definitely happen that the good elastic stocking is compared with a poor inelastic bandage. After procedure, rationale for compression, you know, is a reduction of side effects, inflammation, hematoma, pain, hyperpigmentation, prevention of DVT, and prevention of recurrence. And to optimize the result, you certainly need a strong pressure. You see here the only side effects are shown in the area not compressed. And you see that if you need a pressure about, I would say a mean pressure of 45-50 millimeter of mercury at the thigh level, you certainly don't have enough pressure with elastic stocking exerting just at 10 millimeter of mercury here. So if you have some randomized control study and they show that elastic stocking is better than inelastic bandages, maybe the inelastic bandage was poorly applied. And you can exert a very strong pressure at the thigh level with concentric compression and positive eccentric compression. You see one bandage, and you see these eccentric compression devices that exert a very strong pressure at thigh level. And you can see that it is able to compress completely the veins here. The same is true for ulcer treatment. Very often a good elastic stocking is compared with a poorly applied bandage, and every time the pressure is measured, a higher pressure shows greater effectiveness compared with low pressure. So promoting ulcer healing and shortening healing time is the rationale for compression and prevention of recurrences. Inelastic bandages have been proved more effective than elastic material, improving axial contraction, reducing venous reflux, normalize venous ambulatory hypertension, so in promoting fastening and fastening the healing time. And there are several papers, these are just some of them, documenting the higher effect of higher pressure. So in conclusion, stocking on bandages is not the same. You should use bandages in venous ulcer, in deep vein thrombosis, in phlebitis, in lymphedema, at least in the initial phase, and after surgery or endovascular procedure. And you could use stockings in maintenance phase, so C0, C5, post-thrombotic syndrome, and lymphedema long term. Thank you very much for your attention.